Welcome to today's edition of the Community Calls with the CWA, everyone. Thanks for joining us again today. For today's call, we're going to cover our new reopening guidance that was just published last Friday, give you guys a little walkthrough of the website. We just released our posters for you today, our Climb Smart posters in specific with COVID-19 information for your customers. We've also created a decision matrix tool to help you guys navigate and think strategically around some of these new policies and products and cleaning protocols that you guys are thinking about implementing in your facilities. And then we'll also leave some time for you to ask any questions that you might have around this reopening guidance or any of the new tools that we have for you. Um, to give you a quick little Zoom tutorial as always, feel free to chat amongst yourselves or directly to any of the panelists here. If you do want to chat amongst yourselves, just select the drop-down box in 2 and click on all panelists and attendees. That way everyone can see what you're typing. Go ahead and start asking questions right now, and we'll, like I said, have question time at the end of this call for you. Just type any questions that you have into the question and answer dialog box rather than the chat. That way everyone can see what questions are being asked and can upvote questions. So if you see a question that you really want answered, just go ahead and click that thumb, and that'll raise that up to the top of the list so that we definitely get to answer that for you. During that question time, if anyone wants to speak up, just go ahead and raise your hand. We'll unmute you, and we'll give you a chance to say whatever idea you have. And once you're unmuted, there'll be a little pop-up, and just click unmute myself, and you'll be ready to talk right away. And we'll have the same ground rules that we always have. So just be polite and respectful to all of our panelists and to each other in the chat. If you do get unmuted and have a chance to speak, just keep your comments to about 2 minutes so that we have time to get through all the questions and have anyone else speak that would like to. Keep any personal political commentary out of the chat box or any comments that you might make, and anyone who is abusive to anyone else, we will remove you just to keep the conversation flowing. So with that said, we'll jump right into a tour of our new reopening guidance. We decided to launch this as a website for you guys. And we did that so that we can keep this information updated real time. So as we learn more, as our local, national, international public health authorities give us more information, we can surface that here and give you the latest and greatest that there is as we all try to navigate through the reopening process. So we've based our reopening guidance on largely on the hierarchy of controls that's used by NIOSH, OSHA, and a bunch of risk management thinkers out there. There's a short explanation on the site, so I'll let you guys read through that, and a lot of great resources on the web as well if you want to apply this type of thinking to your other risk management areas. It's a pretty successful and widespread strategy for navigating hazards and risks. We've also divided our guidance into 4 real key areas: communicating with your customers and your staff, the general hygiene of your customers, your staff, and then your entire facility, and the physical distancing, social distancing that we've all come to know and love these days. And lastly, cleaning, a question that comes up over and over again, and a lot of you guys have asked. So as you navigate through the site, you'll see that there's a top menu broken up into those 4 key areas, and then a area for additional information as well. As you click through, pretty easy to read. You can just drop down these accordions to get all of the information in those particular sections. I'll note that as we developed this guidance, we really tried to keep a broad scope. So we're not trying to tell you exactly what to do, but trying to highlight all of the different areas that you might need to pay attention to. So much of this information is going to be hyper-local. It's going to be your cities, your counties, your states, your provinces, your territories, if you're your different nationalities, if you're one of our international members. So it's going to be really important, and to look at all of those different levels of recommendations and laws and mandates that you have to deal with, and figure out which ones are actually applicable to your gym. Even something as simple as physical distancing. So many of us here on this call are in the U.S., so we're very familiar with that 6-foot rule. As you look around the world, that rule can be anywhere from 1 meter to 2 meters, and a couple different numbers in between that get bandied about in different countries. So it's been a really interesting challenge to navigate, as all of you guys have been navigating this as well, figuring out what all of these rules are, where they're coming from, which ones are actual rules and which ones are just things that people are saying. Even if they're government officials, sometimes they're just saying them and they're not actual recommendations or rules. So we've tried to distill all of that chatter and noise into the real concrete areas that you guys should be paying attention to as you develop your own individual reopening plans. So most of the stuff here will be pretty non-controversial and really meant just to get you thinking about what you need to do locally. I will say that a number of provinces up in Canada, a few different countries around the world, will also be developing really detailed reopening guidance based on those local laws. Something that, as an international organization, is harder for us to do at that very detailed level. Um, so the other big key area on this site is going to be this additional information section. That's going to link to some of the blog articles that we've written that are directly applicable to those 4 fundamental areas. And again, we'll keep this updated as more and more gets published. And this will give you a link to download our new Climb Smart posters. We've published those in both the 18 by 24 and 11 by 17 size, so you guys can print out whatever is going to be best used in your facility. And we've also launched a decision matrix tool for you today. You also find all of the references here. As we went through developing our guidance, we leaned really heavily on the CDC and the WHO. Also paid a lot of attention to more detailed state, local, different international guidances as they've been coming out, and then took a really deep dive and broad review of any applicable science that we have to chew on at the moment, trying to figure out of all of these recommendations, which ones are the most evidence-based, and how should we look at some of the unique things in the climbing industry that haven't really been studied before and don't have any direct evidence. What can we take from the general scientific body and apply to our industry? Um, So each of these 4 sections, just to go in some detail, they follow a very similar hierarchy. We're focused on your customer, your staff, and your facility, and in a couple cases, the broader public, including your local governments. So as you navigate, you'll have that kind of familiar cadence, and this is something um, that I guess I would urge you guys to do in your reopening guidance. Make sure that you look at all 3 of those different areas and treat them as distinct things that might require their own unique plans. For instance, the plan that you have for an employee who um, is starting to exhibit symptoms of COVID-19 versus a customer might be slightly different. There's different privacy concerns in those 2 different categories. And then there's also that level of what do I do with my facility? So you might have a couple different strategies going on with with a lot of overlapping similarity, but that need to be tailored to those key areas in your facility. Um, so we'll let you guys go through this, and I'm going to leave a lot of time for questions and answers. So get those coming towards us, and we'll have that at the end. I'm going to dive into showing you our posters. So as I mentioned, we've got links to download those right on this reopening website. And those will be free for all CWA members. If you're just going to our regular climbingwallindustry.org website, then you can just click on Store up in the upper right, and you'll find all of our posters there. You could either navigate through or just type in COVID, and you'll find those posters ready to download. Once you log in, Those will just be free for you to download. There's no price at all for you. For anyone on this call who's not currently a member, do keep in mind we have our membership assistance program going right now. And for any of you who are members and need to renew and need a little bit of financial assistance, feel free to use this program as well. If you have an existing renewal invoice with us, just get in touch with us directly and we'll take care of that for you. But we've decided to offer a free years of membership to all gyms around the world so that they can get access to this information and be involved with the reopening of our industry internationally. So anyone you know who's not a member, feel free to send them our way and we'll get them set up and get them all of the information they need around reopening and everything else. Once you do download those posters, you'll just have a zip file with 4 different posters. We've broken our posters, and the content on the posters is going to be the same for both sizes, the 18 by 24 and 11 by 17 formats. They're just slightly redesigned to fit all the information into those various sizes. Um, the 4 posters that we're releasing right now are all geared towards your customers. So the first poster is just the basic hygiene that we're confident that every gym is going to be urging their customers to follow as we navigate through this. Some of these policies, you might have stricter policies or slightly less strict policies. We've tried to design these posters to encompass all of those different scenarios. Um, so the good hygiene poster will cover the real basic personal hygiene that your customers should be practicing once they're in your facility. It's all of the stuff that we've talked about on previous calls and a lot of things that you've heard from the CDC and your local public health authorities, but set up in a format just to really hammer it home to your customers that they have an extra level of responsibility when they're coming back to the climbing gym. Um, the next poster we have is designed to communicate some of the policies that you might be putting into place as you reopen. And again, these are pretty broad categories, trying not to overpromise based on your individual procedures. Some of you might have policies above and beyond this. I don't think anyone will have policies that are less that this doesn't encompass. But if you do have any issues with this, let us know, and we'll see what we can do to help you. And from talking with all of you guys on these calls, from talking with some of you individually on the phone, these are what we think the core areas that all gyms will be putting into place, enforcing that physical distancing, trying to make hygiene as easy and accessible as possible for all of your climbers and staff, increasing cleaning and being more visible about your cleaning in the facility as you go through reopening. Um, and then again, practicing that good communication with your members, educating your members about what's going to be expected of them as you reopen, educating your members about what your new access policies are going to be, whether you have timed bookings or red light, green light system, or just a walk-in with an occupancy capacity. And then just a reminder that all these climbers are helping to protect your staff as well, and that some of the policies that you might have are designed to protect your staff. Some of you may be required or are just choosing to require that your staff wears masks all the time, for example. So this message is meant to reinforce why you're doing that. The next poster we have is to help you communicate that any occupancy limits you have to your customers. So this is designed to go into at the entrance of your facility and encourage people not to come inside unless you have space for them, and then also reinforce some of those really basic policies that you're going to be asking your customers to take part in before they even enter the building, and reminding them what they should be doing once they do enter the building. So again, back to that physical distancing, asking people to stay home if they're exhibiting any symptoms of illness, just to make everyone comfortable and as safe as possible. And again, reinforcing that good hygiene message. I think that's going to be a real key one that you see over and over again. This poster is designed with that big blank space so that you can just print on, really any regular printer, whatever your capacity is individually, and that might change as you go through different reopening phases as well. So we wanted to make that somewhat of an evergreen poster for you. And the last poster we came up with for you guys was just kind of a more personalized, fun hand washing poster. So, this can go in your restrooms, in any sort of hand washing and hand sanitizing stations that you're setting up inside or outside of your facility. And just again to follow the general CDC and WHO recommendations on what the appropriate method and time is for hand washing. So all of these posters are available for you. Again, just go to the reopening site and you can click these links to download those directly. If you're not already a member, again, just go ahead and sign up. Use the promo code membership assist. It's all the instructions are on the membership portion of our website as well. And we'll get this information out to you. The next thing we're going to cover is the new decision matrix tool that we launched for you. Again, you can click right through to that on our website and make a copy for yourself. And so here's the basic instruction sheet, and I'm going to bring Caleb into the mix to help talk about what we were thinking about as we designed this and some of the ways that tools like this can be used to help with your strategic thinking. So over to you, Caleb.
Thanks, Garnet. So we built these tools with the intention of basically helping gym operators determine the best way to operate during the COVID-19 pandemic. One thing you can do with decision matrices is basically weigh a ton of variables all at once and kind of show your thought process through a complex decision. The other thing that'll help is as things change, you can edit the decision matrix and things might reprioritize. And I'm going to share my screen here and show exactly what we're looking at. So I'm looking at the HYGIENE decision matrix, and in every decision matrix, you'll see that there is the problem in the form of a question, and that is basically what we're trying to figure out throughout this. We'll look at our objectives. This is what we're trying to establish as what a solution should solve, essentially, and then instructions to break down exactly how you'd use the tool. In the tool, what you'll do is you'll start by brainstorming with your team, basically what solutions might fit into some sort of hygiene solution. So in this case, we're talking about hazard controls. These things are things like Garnet was mentioning, like how do we encourage people to wash their hands? Do we create barriers between staff and customers? Do we encourage people to wear masks? That sort of thing. I'm sure all of us are aware that we're getting bombarded with lots of different recommendations from all over the place, and I would encourage everyone to just list them throughout here and then work with your team on answering these questions above. So we can take option 1, 2, and 3 and walk through each question, and then there's a weight associated with them such that when you get a final result, and we can look at an example here, it'll weight it in priority. And so what we'll see out of this is a final result on what solutions might be best suited to meet your objectives. It's not necessarily a final ruling, but it definitely gets rid of some of the fluff. So you might enter something that you've read recently and then find out after answering your questions such that, like, let's say, supported by literature review in preventing the spread of COVID-19, you might find that no one else has written anything on this, and thus you'd give it a 0. And so on and so forth. And basically you're looking at this as a way to prioritize what is important for the gym and specific to your gym, and not really as a final ruling. Let's see. All right. Garnet, do you have anything else you want to cover?
Yeah, maybe might be a great idea just to run through that through the hygiene matrix. That might be a good one as an example.
Sure.
And yeah, let's use that example of just hand washing versus not hand washing and how that might score out in a matrices like this.
Okay, so hand washing, we can walk through and we'll see that. So is it designed to reduce or prevent the spread of moisture droplets from people's mouths? The answer is no in this case. We would then look at, is it supported by literature review for preventing the spread? There's very strong support for that, many international groups. We have to look to the hierarchy of controls for hazard controls. And where does this fall under? This is probably closest to an admin control. Does the local government, national, regional, or local government require the proposed solution? Answer is no, not in this instance, at least where I am. Do they recommend? Absolutely. Is it designed to protect staff? Absolutely. Designed to improve the customer experience? This is a little more subjective. I would say yes. Maybe you'd say no, but either way it should work out. Ease of implementation, super easy. So that's good. Cost, it's more or less free. So I'm gonna weight it too. Does it affect Climber or Blair or does it remain the same? Does Climber, Blair communication remain the same? In this instance, yes. And then are generally accepted safe practices still followed? And the answer is yes also. For no hand washing, we'll see that we'll get a lot of this. We'll get, if it's supported, that's no. For hierarchy, we're not doing anything to prevent a hazard there. There's no recommendation or no requirement here, similar to the hand washing. The local government does not recommend not hand washing. Is it designed to protect staff? In this instance, no. Let's see. Oops. Apparently Google Sheets is reconnecting. Well, anyway, we would continue on. So designed to improve the customer experience, no. And we would continue through and we'd eventually get a result that would be less than 22. So I can continue through that. It is less than an hour still to implement. It is still free. And so we still want to mark these things down because it is important to note that, yes, it's very easy to tell people they don't have to wash their hands. It's very easy. It's entirely free to not wash your hands. That doesn't make it a good idea. And so you'll see that out of this 22, a weight of 22, hand washing is a clear winner over not hand washing. You could also layer in things like, do you want to use an alcohol-based sanitizer versus soap and water? You'll probably see that in some of these certain things will likely be really close. So your result will end up, let's say 22 and 21. So maybe both are a really good idea in that case, but basically it just orders what would work best for your gym and kind of breaking it down into more or less yes or no questions or multiple choice questions. Similarly, if we go to cleaning, we're looking for safe and effective cleaning products and methods to use during the COVID-19 pandemic. We start with a flow chart. First and foremost, is the product known to be effective against the COVID-19 virus? If the answer is no or you don't know, consider looking at the EPA's or their equivalent to the EPA's list of disinfectants. Following that, you can go into, is this product, does the product harm the surface to be cleaned? Consider contacting manufacturers, that sort of thing. And then basically you go through all this because anything that is answered yes to all three of these decisions, and then considering safety measures, you could then enter into here. Basically, we don't want to add anything that won't work against the COVID-19 pandemic. So we're eliminating that prior to entering into this matrix. Once we enter cleaning products into here, we then answer the questions such as, can the surfaces actually be contacted to be cleaned? Or do you have to have any sort of additional safety measures, residues, that sort of thing? The general idea is that each of these questions follows both the science and how effective is a hygiene hazard control, or how effective is a cleaning product, particularly in the use of it, as well as the operational side of things, because everything costs money, everything takes time, and we want to be sure that we're weighting things that cost less money or take up less time, because those are both finite, while also weighting efficacy very, very highly. We were also considering, in talking with some gym owners, other considerations such as, what we saw one question was, does it affect climber belayer communication. That's super important. If you install something that is very loud or in some way inhibits the ability to say take, and that can be a problem. And so we're trying to add in questions, and you could customize this to yourself. Excuse me. You could customize this yourself into questions that maybe are more specific to your facility. Let's see.
Yeah, I think that's a great point to add that, you know, this tool is definitely meant for you guys to use either as is or to customize and extend to just help you navigate all of these different choices. And I was just going to highlight the flow chart portion of this. Those two areas are really the first two areas on that flow chart are the key things to really look at as you're choosing different methods and products for cleaning. Just pay a lot of attention to the ways that you know, different cleaners can react. If you're you know, in general, just don't mix any cleaners. That's a pretty standard recommendation. But also take a look at the way a particular cleaner might be reacting to different surfaces in your facility, whether that's something that's very reactive with nylon that could be adversely affecting ropes or harnesses, or, you know, even something that could adversely affect the paint and texture on your walls. There's a lot of very stringent and strong cleaners out there that that don't necessarily work well for the products that exist inside of your facility. So that second diamond on that flow chart is a really key one.
The other thing with cleaners is, particularly now, a lot of cleaning companies are advertising very heavily. And so one idea is that as you're getting all these advertisements and suggestions and recommendations from all these companies, adding them into the solutions can really help cut through what is all their marketing fluff. So if you really have to look into whether or not something is proven to be effective or is on the EPA or the equivalent list of disinfectants, it really can help cut down on all the various fancy things that are flying around emails and posters and such.
And guys, if somebody wants to use this and customize it for themselves, and they've pulled up the file on Google Docs, how do they go about actually making it editable for themselves?
Right. So if you go to the first sheet, instructions, and then you can either go to the file drop-down menu and click make a copy here, or you can click this link right here and it'll automatically make a copy.
Yeah, and I'd add in, if you go to file, as that drops down, there's another selection for download. So if you're more comfortable in a program like Excel or a couple other different formats, you can export this as a CSV or Excel file as well. Yeah. And with the cleaning matrix, I guess one other thing, just to reinforce the message, the scores that you get out of these matrices aren't designed to have a threshold. Like once you get a certain score, that doesn't mean this is the right thing to use. It's just a way to compare things on that list that go through that same decision-making and strategizing process. So it might be the case that there's 2 or 3 different cleaners you use, and it might also be the case that you're looking at cleaners or methods for a particular use case. So it might be different cleaners in your restroom versus for your holds versus for your mats. So you can kind of extend this and build it out for all of those unique things. Again, just a tool to help you write down and communicate your thinking and your policy creation a bit more. One thing that you'll see in our reopening guidance is a soft recommendation to, you know, document all of your decision-making process throughout this. So if you do have to go and speak to any of your local public authorities or code officers or whoever might walk through your door or email you, that you have, you know, you have a body of documentation ready to go to justify why you're doing certain things. That it'll just help you if you're prepared on the front end as you go through developing all of this stuff.
And Garnet, it looks like we have Howard Konishi with his hand raised. I don't know if you want to
great,
unmute him, and it looks like he might have a question.
Yeah. Oop. You just disappeared, Howard. Throw your hand back up if you'd like to pop back in. We'll get you unmuted. Yeah. And let's see. Yeah, so just feel free to jump in anytime, Howard. I'll keep going with this decision matrix, I guess. So the cleaning one's pretty explained pretty well here, and again, you can extend this to, if you would prefer different questions than these, you can definitely do that. Just think about the way that you might be weighting certain things and which areas are the most important and the least important when making these decisions. The next matrix on this sheet is our event decision matrix. So this will be something that might not be immediately useful for a lot of gyms, but as you're progressing through the reopening process, this is designed to give you an initial idea around everything from competitions, events, youth programs, summer camps, group classes, yoga. So it's a tool that's very broad and really meant to catch like the high level immediate concerns. So this is definitely an area that you might want to tailor to your specific use case quite a bit. And again, as you're comparing things, the way that you compare um, the answers you get for a competition versus a yoga class might be different, but a yoga class versus, say, a fitness class or a learn to lead class might be a bit more, might be a bit closer as you decide which ones you can launch. I will say as well, I imagine this tool will be one that'll be developing as we add more guidance as we move along. I think that's a great little thing I missed and I forgot to mention as we were looking at the website. We have those 4 key areas of reopening that are really the most immediate need for everyone. We will be working on providing additional resources specifically in that programming, classes, summer camp vein. There'll be a variety, just like reopening, there'll be a variety of different dates as to when people can start doing those sorts of activities and programs. So we're going to try to get ahead of that a little bit and get information out as we can, but that is something that it's just an ongoing development. Let's see, the last sheet in this toolkit is our occupancy calculator. This is a pretty simple tool, but just something to help you guys out and take one load off your plate. So take a look at your overall floor plan, figure out what areas are publicly accessible, either by your staff or customers. Total all that up to a square footage number. Figure out what social distance requirement is most applicable to your location, whether that's 1 meters to 2 meters or 6 feet. Throw that number in there, and then there's the real tricky part of this is this reduction factor idea. And you guys have probably all seen this coming from your local public health authorities, where they take typically your whatever occupancy was given to you from the fire marshal and applying some sort of reduction to that, anywhere from 10% to 10% of that total capacity to 50, maybe 20, 50, 75%. This is a number that you can play with just to see how it affects the numbers really quickly and easily. So you can just look at different scenarios without having to whip out a calculator and do it yourself. So just a handy little tool. Things that might go into that reduction factor are movement, clustering in certain areas of the gym, falling, different common areas that people might need to use to rest or change clothing or put on shoes, all of those kind of things. So again, it's going to be very facility and location specific, but just like I said, just a handy little tool for you to access. To access this tool, again, just go right to the reopening website, and there's a link directly to it, and you can download that as an Excel file, make a copy in your own Google Drive, and just play around with it and have fun. And again, for the posters, you do need a membership to access those for free anyway. but that membership is free right now. And I just wanted to take a second to thank all of the sponsors who've been on board to help um, fund and support this membership assistance program that we launched. We really could not, we could not do all of this and that without these guys. So big thank you to all of these sponsors. Click through their sites. All have fantastic products, and we're really happy to be working with them and can't wait to have a drink with them and all you guys at the summit next year. Um, that covers all of the walkthrough that we had for you. So I'm going to open this up just to questions right now, and let's see what we've got. Okay. I saw a great question in here about the posters and why they're specific for COVID-19 and not general cleanliness and viruses. I just wanted to take a second to talk about that one. I think quite simply is that a lot of these issues were under most people's radar for the last, I guess, century, since maybe the Spanish flu. No one other than some people in Eastern Asia have had to deal with epidemics or pandemics at this level, and it hasn't been an extremely pressing issue for our industry. I think that's whether we, change up these posters in the future to address these issues more broadly is a really interesting question, and probably best suited for maybe our industry practices committee as we go through those efforts and continue to look at the best practices for our industry. Let's see what else we have. I've got a couple questions about how many gyms are opened in the US. It's hard to have an exact number on that. There's probably about 60 to 80 right now that I know about. And I would guess that over the next month, there's probably another 50 to 75 that are going to be opening up. So I would guess by the end of June, mid-July in the US, we'll probably be looking at, somewhere between 125, 150 gyms operating. Around the world, it's a pretty similar story. I think most of the dates I've heard for reopening are ranging from mid-May. Number of gyms in a few areas in Germany were allowed to reopen last week, and I think a big broad opening in early July for parts of Europe. The latest date I've heard is out of the Netherlands. Unfortunately, those gyms won't be able to reopen as of now until September 1st. So we're looking at how we can help make an argument that they can open up sooner than that, and hopefully they will be able to. But as of now, that's the latest date I've heard from any country out there in the world. All right. And let's see. What other questions do we have here? Okay, this will be an interesting question for the group here. For the open gyms, for gyms that have reopened, have your customers had any opinion on the amount of climbers in the gym, that there's too many climbers in the gym, and felt uncomfortable and unable to maintain the physical distance? On our last call on Thursday, we had a panel with a few reopened gyms, and overall they were reporting a really positive feedback from their members and customers who've climbed. This Thursday, we're hoping to have or not hoping, we're planning on having another panel of reopened gyms to share their experiences. So I will say, if anyone on this call has reopened and we haven't reached out to you to be on this panel yet, please get in touch with us. You can just email me directly at garnet@climbingwallindustry.org. And we'd love to have you on this panel or a future one. I think we'll try to do this as those reopening panels as a recurring thing, as long as that information is going to be useful for people. So if anyone out there has reopened, I'm going to give you maybe 10, 15 seconds to raise your hand and maybe share your experience about that specific question of whether you've had any climbers who felt like there are too many people in your gym. All right. It looks like we had a typed in answer from Austin Smith anyway, that they also have not had any issues. So that's great to hear. And we'll keep this question on the table for our call on Thursday as well. See, another question about how many gyms have opened, and another interesting question for the reopening gyms. How popular are these open gyms? What's been the uptake? Again, anyone on this call who has reopened and would like to chime in, just go ahead and raise your hand, and we'll unmute you and get your input on this as well. But again, you know, based on the call that we had last Thursday and some you know, good number of conversations I've had with gym owners who've been reopening, overall, it seemed to be a weird but positive experience. And both gyms who were on our call on Thursday had reported even, you know, getting some new members and even some non-climbing new members who were really thankful for their facilities being open. Um, so I think, you know, that question will probably be pretty unique to every facility, but overall, I really have not heard any negative from anyone around issues like how popular the gyms are, what the uptake's like. Okay, this is a great question. Have we learned anything from these climbing gyms as they open up? I would say that personally, some of the things I've learned are just how positive the experience has been. That was a big unknown for everyone, and I think it's a little bit of peace of mind anyway that most people's experience has been overall a very positive thing. And so far from what I've heard, pretty low friction with any public health authorities as well. I'd say for the gyms that have opened up, some of them I know have been in direct contact with their local public health authorities and have had, you know, their reopening plans. I don't know if vetted is quite the right word, but at least reviewed by those groups to make sure that everyone is on board with them reopening. So uh, overall, I think a lot of the strategies that we've presented here are pretty solid, and at least to date, I haven't seen any pushback on any of the suggestions that we're making and any of the policies that gyms are choosing to put into place. So yeah, I think if we learned anything, there's some some bright light for the future, and we just got to hang in there and chase it. All right. Okay, we've got a question for Reopen Gyms about youth programming. At least to my knowledge, no one is running any youth programs right now. I could be wrong about that. There's a good number of gyms that have opened up that I haven't been in touch with. Um, and again, anyone who is running a youth program, feel free to throw that hand in the air, and we'll hear from you, or join us for our call on Thursday, and we can dive into this. I think most of the dates I've seen for just the general like summer camp industry and schools put some of those dates for youth programming a little bit further on than just general gym opening. But we'll keep an eye on that and let you guys know as we learn more. Um, any info on gyms that are
Looks
open?
like we've got Brian Pletta
Great,
with
thanks.
his hand raised.
Yeah. Just saw that. All right, Brian, you're good to go.
Hey, Garnet. I thought this would just be easier to talk about it than type. I'm a pretty bad typer. So I was just wondering what kind of the consensus is on cleaning or sanitizing top ropes and auto belay lanyards. You know, it's something that I had not really put a lot of importance to until just this last weekend. My wife and I went into the gym to climb, and we were doing some top roping and noticed that the rope had a tendency to hit us in the face, and of course we're breathing on it the whole time. Yeah, just wondering, you know, what people's thoughts are on cleaning the ropes, keeping them clean. You know, are they putting a plastic sleeve over that can be wiped down, or you know, what importance do other gym owners what are they putting on this the thing with the ropes?
Yeah, it's a great question. And anyone out there who'd like to speak to it, feel free to raise your hand. We can have a little conversation about that issue. Yeah, go for it, Bill.
Take myself off mute. This is Bill Carlson with Headrush Technologies, make the True Blue auto belay. And kind of from the start of this, we did a lot of research into how to clean the auto belays and the lanyards. So I'll speak specifically to that with our devices. And we found, we do actually recommend a mild soap and water, which is the best way to clean most textile materials. But we also did the research to find out that if you use a 70% solution of isopropyl alcohol, that black does a disinfectant for the lanyard and essentially make it safe to use that equipment.
Yeah.
Yeah, I've seen your guidance on that. I've seen Perfect Descent's guidance on it, and those are probably reasonable things to do at the end of the day, or possibly a couple of times throughout the day. But it's not really reasonable to do it between climbers. So I'm wondering if anybody has a good solution that customers could sanitize a rope between climbers, maybe a plastic tube that could be wiped down or something like that. If you're doing that with isopropyl alcohol between every climber, you're going to end up with a pretty soaked rope or lanyard at the end of the day.
And to a certain degree, that's the purpose of a 70% isopropyl alcohol. That mixture of the alcohol and the water allows it to stay on the lanyard long enough to kill any viruses or bacteria, but then evaporate in enough time not to create an issue with the lanyard. And there are isopropyl alcohol wipes that are available, which could be a solution between different climbers being on a particular route.
Okay.
Yeah, and just another area that can be mitigated somewhat by good hygiene. Face contact, especially on a top rope, is a little, definitely something that's a little bit harder to control. But in general, yeah, just that good hygiene should be a great tactic there as well. And let's hear from Jason about this.
Morning, guys. Jason with Rocks and Ropes in Arizona. We just decided to manage what we can manage, right? I mean, we don't really see a difference between the ropes and the holds. We do see a difference in things that we can manage, like belay devices, handing those out and disinfecting in between pairings that they've been distributed to. And we're not doing lead ropes. We're going to inspect. Going to go back to people providing their own lead ropes and inspecting them. Difference there being that people tend to bite them, right, for slack. Mm-hmm. It's basically all. I mean, we are going to be requiring masks. I've had my family and myself and some of the team trying that out. Not great, but beats the alternative. So that's all I got.
Yeah. No, thanks for that, Jason. I think that's yeah, kind of the realistic view that we have to take to balance the business needs and the feasibility of opening the facilities with trying to mitigate as much risk as possible. Let's see. Okay, got a big question here. A couple of votes on masks. I think that's a pretty broad swath. There are definitely areas that it's just usually a county or city mandate that masks just have to be worn, so you'll have no choice if you are in one of those jurisdictions. I heard some creative ideas around requiring masks in certain parts of the gym or in all parts of the gym, and then allowing guests to take them off just while they're actively climbing, just to help control that indoor environment as much as possible. And there definitely gyms out there that are not requiring masks. In our guidance, one thing we did mention is that if you're a gym who's not requiring masks, it's probably not a good idea to ask people to take their masks off. If people feel more comfortable in masks, even if it's not a requirement, you know, let them wear their masks. That's probably the best course of action. In the U.S., I think most areas that I know about, staff are going to be required to wear masks, and that might not be true in every single city out there. So another one of these things where you have to look at the staff, the customer, and the facility-wide hygiene practices. There just might be different rules for different categories. All right, and question here about if any gyms have shut down after reopening. Not that I've heard of. And if anyone out there has heard otherwise, yeah, feel free to throw your hands up or type that into the chat. But you know, the first gym to open up in the U.S. Was April 24th, so it's barely, hasn't even quite been a month yet. So I don't think we've kind of, if there is a tendency towards that cycle, it's probably still a little bit early to see that happen. Who knows, you know, if that was to happen, when it would, but we'll definitely keep an eye on that as situations develop, or hopefully don't develop in this case. Let's see. Okay, question here about whether gyms out there are cleaning their walls or not considering that difficult or important. I think that's a very similar, you know, question to cleaning individual top ropes and cleaning climbing holds and roots. The general position we've taken in our guidance is that the contact transmission of this particular disease, by all accounts and all evidence, seems to be not the primary function. Not that it's not a risk, but it's not the primary mode of transmission. And as such, a good way to control that risk of contact transmission is with proper personal hygiene and you know, attentive care to yourself. So that's our general position. It's also a position I know is shared broadly across all of our international partners in the climbing world as well. And I do think that there's a lot of evidence to back that, and is a practice that you see, frankly, in, you know, in almost every industry out there. You're not seeing individual items in retail stores being cleaned. You're not seeing restaurants operating like that either, or being required to operate at that level as well. So I think that's a very strong position to take, and it's frankly almost the only one that's practical from a business standpoint as well. So I think for both of those reasons, that's going to be the answer to a lot of those kind of questions when it comes especially to the contact transmission. Is you need to take a careful look at you know, where you can mitigate risk in your facility and what the biggest risks are, and that's where some of those decision matrices might help you. So you know, as we were mentioning, certain questions in those matrices are weighted more heavily, and one of the questions that's weighted particularly heavily is this measure designed to reduce the transmission of respiratory droplets, since that does appear to be the primary form of transmission for COVID-19 specifically. So yeah, we're getting close to the end of our time here, and just want to say thanks again to all the sponsors for that membership assistance program. If any of you guys aren't members yet, you know, go ahead and sign up right now. It's free, and we'd love to have you on board and hear all of your thoughts on these calls. Join us Thursday again for that panel of reopened gyms. We've got a couple on board already, and we'd love to have some more. So if you're on this call and your gym's open, please reach out to us. And if we don't get you on this call Thursday, like I said, we'll try to make this a recurring series of idea sharing and information sharing. So if you want to reach out to us to get on that panel, or with any questions you might have around the reopening guidance or anything else, as always, we're always here for you. You can just email any of us directly. We're all working on these questions just constantly. So yeah, I'd love to hear your thoughts, your ideas, your concerns, anything at all. And that'll be it for now. So we'll see you on Thursday with that panel discussion. Thank you very much for all your time. Bye.